Good morning for all the folks who are joining from the West Coast, respectively, like good afternoon or good evening from whichever space you're joining in. I'm really excited because this morning I have a guest, Amit Samant, who is a Chief Product and Business Officer at Somatrix. And he's going to be delivering a very interesting topic that's about remote patient monitoring and from the perspective of a wearable device. So this is a really interesting topic, and we have been getting a lot of questions about wearable devices and especially like AI integration with healthcare. So I hope this is an informative session for you guys, and please make sure to put in your questions whenever you have them onto the chat. We will be answering the questions through the presentation. So if at all you are having any questions or you want anything to be clarified, please feel free to put that in the chat. Also, through the end of the presentation, we of course will be sharing the deck that Amit is sharing right now in the description of the video, so you can refer to that. Additionally, this is a recorded session, so you don't have to worry if you need to like leave in the middle of the video. So you can anytime like come back to the video and like attend the entire session. So thank you so much, Amit, for being here.
Sure thing.
I'm really happy that you could make it to the session today, and I'm really glad that we could get some time out of your busy schedule. And I was very curious because you've been working as like a product officer in Dell as well before this. So I wanted to learn more about like about you, like what you have been doing, and what do you do at Somatrix right now.
Yeah, sure. Hey, so good morning, everyone, and hello, everyone, wherever you may be. And Aishwarya, thanks for the opportunity to come in to AI Guild and talk a little bit about what we have been doing here at Somatics. So let me just give a quick background about myself. So I've been in the tech industry for 20 plus years or so. My educational background, I have a PhD in computer science, specifically in data analytics and data visualization. So did that for quite a few years at companies such as NetApp, Riverbed Technology, then at Dell Technologies as well. Sort of where the problem statement I was working on is, hey, we collect a whole lot of data. How can we get insights and more information out of that data using either data visualization tools or data analytics tools? Then sort of I branched off and got into more on the business side of things, into product marketing, into product management, still keeping that common thread around like working with data, because that's sort of one of my biggest passions, is to work on data. So then I got into this area of how is it that you manage the data, store the data, protect the data, and overall secure that data. So I think COVID has caused a whole lot of changes in how we do things, a lot of changes for people as well. So sort of it made me take a step back, think a little bit about what is it that I want to do going forward. So sort of I got this opportunity of working in the health tech space. I always was interested about the health tech space and how is it that you can apply data analytics like AI, ML, predictive analytics technologies, especially in the health tech space, and sort of have a bigger impact. So that was sort of one of my focus areas I wanted to get into, sort of my passion. So that's how I got started into Somatics, because like the technology is great, and hopefully like you all would agree with it once I start talking about it a bit more. But how is it that you can use data analytics, AI, ML techniques to improve patient outcomes? So sort of our mission at Somatics is how is it that you can improve patient lives in a cost-effective manner using technology, and that's what something we have started doing. So that's how I got into Somatics as the Chief Product and Business Officer, focusing on the business strategy, the product strategy. What are the next generation products we want to bring to market?
That's
so with
amazing.
that, let me transition into the slides, and we can get into more detailed discussion on this.
Yes, for sure.
Great. Yeah, and everybody, please feel free to stop me at any point. I would like for this to be an interactive session. So whatever questions come through chat, Aishwarya, please stop me
Yes,
at any point.
absolutely. I will do that. So I think you might need
Get
to click on the share screen. Yeah.
me. That's not the. Okay, let me know if when you see my screen.
Yes, it's visible.
Could you see it?
Yeah.
Okay, great. Yeah, so the topic that I want to discuss is how is it that you can use wearable devices along coupled with AI powered technology to improve the quality of care for patients in a cost effective manner. So something by using remote patient monitoring. So that's something I'll talk about in this session. So here's sort of a couple of sentences of about what we do at Somatics. So we have built a AI-powered remote patient monitoring platform for healthcare providers such as nurses, caretakers of elderly patients. And how is it that you can use wearable devices, especially the gesture detection technology? That's our patented technology that monitors the patient's activities of daily living, whether it's sleeping, walking, drinking, smoking, 24 by 7, collect all of that data and provide clinical insights. And sort of the segment that we are currently going after is elderly patients. But that doesn't mean that our technology wouldn't work in other use cases as well. But being a startup, sort of that's the focus area currently we are going after. And sort of here's a brief outline of the next 40 minutes or so. I'll talk about the why, what's the motivation behind this, what is it that we do at Somatics, then what is it that we do at Somatics, then how we do at Somatics, and I'll give a couple of live demos around like some of the technology that we have developed, and then I'll wrap with some conclusions and next steps. Okay, so let's talk about the why. So we did some market research to, like to do some product market fit, if like sort of whatever ideas that we had, whether do they really lend itself well into what the customers are looking for. So here's our a couple of data points around that. So we see the data that we collected from market was that the elderly population, the life expectancy is growing, which is great. So that shows that sort of like technology coupled with uh, the changes in the healthcare have improved patient lives. But also it brings a few challenges with that as well. There is senior folks want to be more independent. They don't want themselves to be in hospitals and nursing home facilities. They would rather like to be independent. So how is it that uh, we can enable that? So also another data point is that about 33% of the elderly population, that's 65 or older, suffer from a fall every year. So that's a pretty big number. So how is it that you can be more proactive in that space and maybe potentially avoid that? So that's something that we took into account as we were working towards building a passive remote patient monitoring solution. And here's some of the other data points as well. Um, so the readmission rates at hospitals for high risk patients, such as with chronic heart failures, with pulmonary diseases, that's a big number. Like about 1 in 4 high risk patients have to be readmitted into hospitals. So that creates a big financial burden for these hospitals, because if a patient is readmitted at a hospital, uh, the hospital has to shell out on an average 15,000 per patient if they are readmitted within 30 days. So that's a big revenue loss for the hospitals. So how is it that you can try and avoid that by taking better care of the patients by monitoring that upfront, making sure that before a patient is released to go back home, uh, we take appropriate actions to make sure that is the patient really ready to go back home. And that's something that we try to do with our remote patient monitoring solution. So let me pause here, see if there are any questions around why there is this need of having a passive 24 by 7 remote patient monitoring solution.
So one of the questions that we have, Amit, around this is when you mention like passive patient monitoring system, right? So what's the motivation behind having this in terms of like, is it also like more towards collecting the data that's being monitored?
Yeah, like a very good question. So, like patients, sort of the data that we collected from our potential customer base was that uh, people don't like to be monitored 24 by 7 from somebody coming into their rooms and checking their vitals. And all of these are sort of episodic readings, in the sense that, okay, somebody, either a nurse or a caretaker, um, comes to the patient, measures their vitals, and then maybe after, every 4 hours or every 8 hours or every other day, they come and measure and get that data. But so that's like an interruption to their daily living, right? So, but instead of that, can we collect data 24 by 7 through passive means, that is through either wearables or through patches, so that nobody really has to go to the patient unless and uh, absolutely needed, in the sense, if there is an emergency or something, then of course there needs to be some sort of an intervention, either from a nurse or a caretaker to come and do that.
Mhm.
But by doing it passively, you are not affecting their I guess their ecosystem or their habitat in terms of how they live their lives. So that
Makes
was
sense.
one of the primary reasons where people were attracted towards this
Mhm.
passive 24 by 7 monitoring.
Makes sense. So, like following up on that, right? Like when you already have this data, like for example, like any of the patients have this wearable device, and every minute or like every second, their data is being tracked. So, while when you are trying to do this, like there is an end goal that okay, like we want to collect data similar to how we used to do it when nurses used to do it more actively, right? So, did
Right.
you find any other use case that was, interesting that you can do with the streaming data that comes in, which is now going to be probably more periodic and would be in higher frequency than a nurse going into the room and like taking the readings, right? So, what are the new use cases, or like what do you feel that this data can be used for? Did you come across like any other like either a predictive modeling approach or like a prescriptive modeling approach using this data that's been collected, and how do you feel like this is better than having like the nurse collection data compared to like comparing these two just from the perspective of like how the data can be used rather than just the frequency of it.
Sure. Yeah, absolutely. Yeah. So there are two questions. So let me tackle the first one. You said, like, what are potentially other use cases that come to mind based upon this 24 by 7 uh, passive collection of data, right? So the one use case that comes to mind is for athletes. Like you can monitor their activities in terms of how they are training. Um, by collecting this data 24 by 7, you can sort of identify as to, in order for them to provide peak performance, uh, by capturing all of these activities 24 by 7, you can come up with, okay, so what are the trend lines in terms of for this particular athlete, and as they are doing their training sessions, where is it that they are lacking in certain aspects.
Mhm.
Of course, I'm not a professional athlete, so I don't know the whole lot of details, but just to talk a little bit about the use case is, as you collect the trend lines across a particular professional athlete, you can identify the gaps. So what are the areas where they can focus on, so that as they ramp up their training, or the next day they can improve upon certain aspects of their training, so that whatever, whether it's let's say a running back in football, so you need to make sure that your center of gravity and sort of your legs are really strong,
Yeah. Yeah.
like your lower body compared to your upper body. So how is it that you can
Yeah.
come up with a training pattern for a running back
Yeah.
based upon these analytics? So
Yeah.
that's something that comes to mind. For swimmers, upper body strength is really critical. So how is it that you can improve upon by
Mhm.
capturing all of this data?
Yeah,
So
yes.
that's one use case. In fact, like there are a few startups that have already started doing that as well currently.
That's something which you like rightly targeted. So I want to like go through the second part of the questions, right? So that's
Yeah.
again like tying back to like the use case that you mentioned. So even when I'm watching like say a cricket match or anything, I see that a lot of the live data that's
Mhm.
happening with the players, like how they are swinging the bat, or like how they are responding to like ball coming towards them, like what's their reactive time, etc. All this is being captured by smaller sensors or like wearable devices on them, like throughout the games. And the
Right.
purpose of that is all not just like doing like a retrospective analysis on like looking back in time that okay, how did this person perform, but it's also used during the game. Like a lot of these sensors or like these devices, the data that's being collected is being used throughout the game. Like it's being like that data is being actively used through the game just to
It's
see
real
how
time.
they
Yeah,
feel.
like real time
Exactly, yeah.
analytics. Right.
So
Yeah,
there's like yeah,
absolutely.
real time analytics that's happening. So with respect to like wearable devices for patients especially, apart from doing this like analysis which is from like a retrospective perspective, where you're like
Right.
collecting the data and later on doing some kind of analytics on top of
Right.
it, how does that compare to what you're doing in real time? Like, is there any activity that you're proposing to have in a real time? Let's say to just monitor if a patient is doing fine in the ward, etc.
Right. No, in fact, the analytics that we do, it's real-time analytics. So this is sort of the smart band that we use. As you can see, it's like a pretty simple bare bones smart band device, which has just one button, one emergency button. So that's the only active thing that a patient would have to do. Otherwise, data gets collected passively. So that, let's say, if they need some help, they just press the emergency button, and that sends out an alert, a notification to the caretaker or to the nurse. But the data that we collect, we do real-time analytics. That is, it has the sensors, the accelerometer, the gyroscope, which collects all of the activities. And based on that, even the classification that we do it on the band itself. So you can consider this as a way for us to compress the data before we send it out to the cloud.
Hmm.
So so we do like whether a person is drinking, smoking, we can do those gesture detections and that classification right on the band itself. So
Got
that's one of sort of the core capabilities that we provide, so that you can provide the alerts and the notifications in real time to the caretakers. Now, for example, if a patient falls down or something, so
it.
that triggers, uh,
Um,
like, because the sensors detect that, and through our platform, we can send a real time alert, a notification to the caretaker, who can then come and take care of the patient. Since like we also have GPS tracking, since this band through BLE is connected to your smartphone, and then through the
yeah.
smartphone to the cloud. So then, sort of depending upon that detection, the caretaker will come and take care of the patients. So
Got it.
things that we do is on a real time basis. And as I go in the next few slides, I'll talk more as to
Sure.
what is it that we do from a predictive analytics perspective. What is like, what are the real time stuff? What is the clinical insights that we
Perfect.
provide as
Sounds
well?
good. Sounds good. So we can continue with your
Cool.
slides.
Let's go. Okay, so here's what the platform comprises of. So I talked about the smart band. Then there's a caretaker dashboard, sort of, which provides more data about the patient that we collect, and I'll go into a short demo around that, like in the next few minutes or so. Then we also have a user app. So if a patient is curious and wants to monitor their health, like they can do that. So especially in a sort of in a home setting, in an independent living setting. So this is where patients would like to monitor their own health, and so through this app they can do that. Then there's a caretaker app as well, which is mainly targeted towards the caretakers, the nurses, then also family members as well, so they can take better care of their aging parents or relatives or so on. Here, the key thing here is the patented gesture-based detection through these wearables that helps us to provide real-time alerts, reminders, and notifications. And then we apply predictive analytics on top of that. Okay, so what is it that we do? Walking. Yeah, walking, through your sensors, accelerometer, gyroscope. Most of these, our competitors do that. Walking, it's pretty common. Sleeping also, it's pretty common. Our commercial smart band companies do that as well. So the additional thing that we also do along with that, along with the quantity of sleep, we also measure the quality of sleep as well. That is through a peer-reviewed scale. That is the Pittsburgh Sleep Index, which is a range from 0 to 100%. We also calibrate the quality of sleep as well. And that's something that we use in our predictive analytics to gauge, okay, how is a patient sleeping? Is their sleep quality deteriorating, improving? And if it is deteriorating, then maybe there needs to be some sort of an intervention through the caretaker, right? Falling. So there are some competitors who do forward falling. So we do both forward falling, backward falling, side falling as well. And that's purely because of the high grade accelerometer gyroscope sensors that we use. In fact, in our next generation product, which will come out by December of this year, we will also have like additional sensor, like a barometer, which will also help us more accurately detect the falling. Then drinking. So that's one of our competitive advantages is, at least to my knowledge, nobody else does the drinking detection and not also calculating the quantity of drink as well, to down to the accuracy of milliliters. So that's something that we do as well. That is, and then I'll give a short demonstration around the drinking aspect, because drinking has two things, right? One is the detection of drinking, and then the next one is the conversion of sips to milliliter. That is how much drink intake that you had. Then the other one is medication intake. So this is something that we plan to bring to market by the end of this year as well. So that is a patient taking a pill through your hand gestures. So this is where you are calibrating the hand gestures and detecting that, okay, the patient is taking medication, not drinking or not falling or not smoking. Then smoking, in fact, that's something that we started off the company with. So that was the first thing that we started, smoking cessation. So that was the capability that we provided. So we not only detect how many cigarettes somebody's smoking, but also down to the accuracy of how many puffs of smoke that somebody has. Then emergency button. I talked about one single button that's on the smart band. Then the activity levels. So this is something that we calibrate 24/7. All of these things like walking, sleeping, falling, drinking, smoking, wandering. Like through GPS tied to the phone, we can sort of like come up with a safe zone for the patient, whether the room that the patient is in or the facility that the patient is in. And like you can imagine, like patients with dementia who sort of keep wandering, and then they leave their rooms or their floor or their building, then that can trigger alerts and notifications to the caretaker, and then they can bring the patient back to where they are supposed to be. Then the heart rate and SpO2. So in our next generation product, we will also have optical sensors that will help us gauge the heart rate and SpO2 24/7 as well. So that's something that we would bring to market. And then along with all of this data that we collect, we do predictive analytics. What do we do with that? We do UTI, tract infection risk analysis, pressure sore risk analysis, the readmission risk analysis. So all of these data, there's a correlation between the amount of time that you're waking up at night, the frequency of bathroom visits, especially at night. So that indicates some sort of a UTI risk. So that's something that we gauge. And I know most of the folks probably on this call are from a software background or maybe an engineering background, right? So sort of the same analogy that I like to use here is that if we can identify bugs and defects in the early cycle of the development process, that's a big cost savings than compared to if you were to find bugs and defects at the end of the development cycle, right? So similar to a person's life as well. If we can uh, proactively identify uh, certain patterns, and especially if those patterns are deteriorating, then and if you can have a like a point of intervention early in that cycle, you can identify those risks and take better care of the patients. So what is it that differentiates us from others? So I talked about the gesture-based detection technology. Then with our platform, you don't need to have additional hardware or sensors installed either in the patient's room or in their houses. So it's everything is done passively 24/7. It works indoors, it works outdoors as well. So that's some of the competitive advantages that we have against our competitors. So yeah, let me pause here real quick. Yeah, I know I talked for quite a bit. Like happy to dig deeper into any of the stuff that I mentioned so far.
I think we're going good. Just one question that
Yeah,
came up is that if the skin is dry for people who are using these wearable devices, would that affect the way it's working? Or like, is there any physical hindrances to the device that can be caused?
yeah. Interesting question, and let me show you. In fact, like we went through multiple iterations of our smart band. Like the first one that we started off with was sort of a bigger band, a bigger form factor. So people said that like this is something, it's too bulky for the patient. So we sort of kind of slimmed it down a bit. Then the next one that we came up with, hey, is there a way that we can charge the band directly without having to take out the capsule? In fact,
Oh, okay.
sort of there's this like capsule. It has a charging port, like
Mm-hmm.
a USB charging port on the side. So here you have to take out from the band and then charge it.
Mm-hmm.
So it creates some hindrance. So also the material of like the silicon material that is used to create the band, that was also at times creating rashes. So we took all of this feedback into consideration in order to come up with our next generation smart band. And that's what something that we currently have. So yes,
Got it.
we definitely did take into account the feedback that we received to make sure that especially for elderly patients or senior population, the
Yeah,
skin might be softer. It might be easily prone to like getting rashes. So we wanted to make
makes
sure
sense. Makes
that
sense.
they can keep the band for longer durations, because if they take out the band, then that means we are not collecting data 24/7. So
Makes sense.
uh, the adoption and adherence of the band with the patients was absolutely critical for us.
Makes sense. So when I'm thinking about the bands being used, right? So the bands are going to be coming from the hospital. So your the bands are not like something that needs to be bought by the patients, but it's bought by the hospital or the medical organizations, right?
Yeah, yeah, sort of.
Okay.
Our business model, or the way to look at us, is we are in the B2B to C space. So sort
Mhm.
of our customers are hospitals, are nursing facilities, long-term care, like assisted living facilities.
Got it.
Uh, so we provide them with the bands, and the nurses,
Got it.
caretakers, are the ones who work with the senior population to you know uh, for them to have the bands on their
Makes
hands. And
sense.
then yeah, so like for us, the feedback both from the caretakers, the nurses,
Mhm.
and the patients is absolutely
Mhm.
critical in terms of making sure that our next generation product further increases that adoption and
Got
adherence
it.
from the
Got
end
it.
patients.
Also, Amit, when you're using this like device for collecting data, right? You mentioned that like the nurses or like the hospital facilities will be notified for different things. Where is this
Right.
notification happening? Is it something that like the doctors or the nurses need to have some app downloaded on their phones, or is it like platforms which is installed on the computers of the hospital?
Right, right. Yeah, it's a combination of both. So we have a safe being platform that it's like it's a simple web-enabled platform that they can like have on their monitor sessions.
Mm-hmm.
But then nurses and caretakers are always on the go, right? They
Yeah.
taking care of the patients, being on the floor, and so on. So they can also download a caretaker app on their phones, and
Mm-hmm.
then they know who the patients that are assigned to them, and then they can just click on the patient name, and then they can get all of the data for that particular patient. And then
Got it.
if there's any emergency alert or notification, it will go
Mm-hmm.
directly onto their app on their phone,
Got
or
it.
the
Got it.
as well as the dashboard as well.
Got
But
it.
then also, like one of the things that we realized is at times hospitals and these facilities already have their uh, dashboards either through electronic health records or some
Mhm.
sort of a platform that they already have. So the feedback that we received was, hey, is there a way that we can integrate your data
Yeah.
into our already existing
Yeah.
platform, so
Right.
that like we can have this single pane of glass view of
Right.
looking at the data. I don't want to be have
Mhm.
okay, one tab open on my desktop to look at Somatic's SafeBeing platform versus
Yeah.
the electronic health
Yeah.
record. So we did that as well. That is, we integrated with the electronic health records, especially point click care, which has about 60% market share
Mhm.
for the elderly population with the electronic health records. So
Got it.
that's some integration
Interesting.
we did,
Okay.
and we are also working towards like other integrations like with Yardi and some of the other players in this space.
Okay.
Yeah,
Got it.
yeah,
That makes a lot of sense. And one of the things I was interested, like, I was just curious, and like Mike also like mentioned this question on the chat, is about like health metrics, right? Like, if you have
mhm,
any AI models running, which like what I mean to say is like how is the abstraction done? Because um, being a data professional, we might be able to understand different kinds of visualizations, or we might
mhm.
be able to handle when models are running, and like how their predictions are going to come out and how we can use it. But how is
Right.
that abstraction done for the medical professionals? Because the model that's running, or like there could be some AI technology that's used both for like predictive and prescriptive approaches, and that's being shown on the dashboard. So how is it abstracted for medical professionals, and how do like what I mean to say is how is there still AI, but that still doesn't feel that complicated for the medical professionals?
Absolutely. Yeah, yeah. So therefore, like through these dashboards, through these apps, whether the user app or the caretaker app, the users or the caregivers really don't have to do anything. The data that we provide, the graphs, the charts, which I'll show in the next few minutes, those are purely for providing the context for them
Mhm.
if they are curious to see what may potentially have caused for this alert or for this notification to be
Mhm.
sent. From a user's perspective, in our case, which is either the nurse or the caretaker, uh, they purely are concerned about, okay, am I do I need to go and look after the patient? Is there an alert or emergency that is being triggered, or a
Mhm.
risk that is being notified? Which means, like a UTI risk or something. If we
Yeah.
provide that as a notification, what that means is, okay, yeah, looks like I need to. In the sense as a nurse, I need to go and maybe monitor this patient a little bit more closely than what I have been doing, because
Yeah.
it seems like there is something going on that probably I didn't figure it out in the last few days, but at least the data is telling me that I should go and monitor them a little bit more closely. So that's the intent
Yeah.
of these platforms. But there is no expectation for the end users, whether the nurse or the caretaker,
Mhm.
uh, to have the ability to parse the graphs or the data or have any sort of background in data analytics. But this is purely
Makes sense.
for going back and looking at the context.
Yeah, makes sense. So following up that, right? Like when you have the platform and you have like models running, there has to be like model monitoring, right? Like I'm assuming that that is something which like Symmetrics does, or how does that work? Because I'm just like giving an example, right? Like let's say there are 50 different medical organizations which is using your device, and
Okay.
now all of them are like collecting data. There is like models running on each of these independent systems which are not talking to each other, right? Like that's independent
Right.
entities which are using the models.
Right.
Now there is a possibility that somewhere there are corner cases, or somewhere there are cases which is triggering the models to not work in the best way possible. So how does Somatrix take that into consideration? Like how does Somatrix make sure that wherever the models are running, like the feedback from the data that they're getting is up to the mark, or like how do they retrain the model and like take care of the model drift,
Got
etc.
Got it. Got it. Yeah. Uh, Somatics was founded in 2015, and the next, like it is headquartered in New York, and our R&D center is in Israel. So our data scientist team is in Israel. So we spent 3 years trying to perfect our model, collecting a whole lot of data from uh, our early adopters, that is doing a whole lot of pilot studies.
Hmm.
Because in order for any technology to be adopted by a health institution, it has to go through a whole lot of rigor before they can really adopt the technology. Because here you're talking about patients' lives, right?
Hmm.
So therefore, it has to go through a lot of pilots, POCs, clinical studies before something
Yeah.
gets used by by these institutions. And of
Hmm.
course, we are not a FDA medical device. We classify ourselves as a clinical decision support system.
Okay.
Okay. So going back to your question, so we collected a whole lot of data, did a lot of analysis of the data in terms of like coming up with our models for 3 years, and we just had a product out in the market early last year. So
Hmm.
that's the sort of the due diligence that we went through to make sure that the sensitivity and specificity of our algorithms is to a point and high enough where we can truly provide good clinical insights that can enable the caretakers to take better care of their patients. But
Got
that
it.
doesn't mean that we are just sitting back on the data that we have collected. In
Hmm.
fact, we have right now a whole lot of experiments, data collection that is going on, because we want to make sure that we keep on retraining our models,
Yeah.
collecting a whole lot of more data so
Yeah.
that we can further improve the sensitivity and specificity of our algorithms.
Got it. Got it.
Yeah,
So when you say like training on more data, this is the real data that's being collected by the patients, right?
yeah, yeah, absolutely.
So, do you like, does Somatrix collaborate with like certain medical organizations to use the patient data? Because like that goes under HIPAA regulations, right? So how does that work? Like when you want to like use real world patient data?
Yeah, I mean, like we do these pilots with various hospitals, and of course, uh, we make sure that we follow all of the security policies, like that are laid out from a HIPAA perspective, from a GDPR perspective, from a PIA, PPI perspective,
Mhm.
to make sure that all of the data is sanitized, anonymized before we do
Yeah.
anything with that
Yeah.
data. So of course, that's uh, that's something that we absolutely take care of before we engage into any of these sort of collaborative studies with these health
Got it.
institutions.
Got it.
And
Got it.
I'll,
Makes sense.
yeah, in the next few minutes, I'll also provide a quick snippet of some data that we have collected based upon a pilot study that will address sort of the so what question in terms of the platform that we have developed.
Yeah, yeah. And Arian, I think yes, we do have slides, so we just like switched back to a speaking mode. So we're gonna have the slides, and Amit is also gonna be going through some demos as well. So
Yeah,
just for that, yeah.
absolutely. Yeah, let me pick up the pace here a little bit. I know I have quite a bit of material and we only have some limited time left. Okay, so we can also integrate with third-party devices such as blood pressure cuffs, SpO2 scale, glucometer, and since most of these devices nowadays are also Bluetooth enabled, so what we can do is, along with our platform, we can collect those sort of episodic readings from these devices as well, so that I talked about a single pane of glass platform that can provide you all of the data, because at hospitals and nursing facilities, you can imagine, they already have these devices, the Bluetooth cuffs, SpO2 scale, glucometer. So along with our platform, can we also collect all of that data and then provide a holistic view of that data? So that's something we do as well. Okay, so here's sort of a breakdown of the functionality. Like the three things: the real-time emergencies, whether a person has fallen, wondering if they pressed the help button, the emergency button, so that triggers the real-time emergencies. Then the clinical insights, whether somebody is having an insufficient sleep, because we do baseline analysis, we look at the trends, and then based upon whatever the caretaker has placed in as um, as part of the onboarding of the platform and the patient, we can identify those trends, like whether dehydration, nighttime walking, sort of irregularities in their activities of daily living. Then the predictive analytics is, okay, we have collected a whole lot of data. Then how is it that we can provide the UTI risk analysis, whether sort of correlation of multiple things, but sort of the main factor here is going to be uh, the frequency of bathroom trips, especially at nights. Then the fall risk is the patient waking up multiple number of times at night. That coupled with a few other factors. Then the pressure sore risk analysis is the patient not turned in their bed for more than 2 or 3 hours. So that indicates that they may have some potential pressure sore risk. So that's these are sort of the predictive analytics that we provide. Okay, so now let's talk a little bit about the smart band. So we call ourselves as a big data software company in the health tech space. So our platform can run on commercially available smart bands as well. But the feedback that we received from our customers was that, hey, the commercially available smart bands, the um, sort of the battery life on them is not that great. Maybe hardly lasts a day or day and a half. But for the population that they are taking care of, that is the elderly patients, you can't expect them to charge the bands every day or every other day. So we needed to have a battery life of at least 3 days up to 6 days. So that's one of the reasons why we decided to build our own, uh, like a purpose-built smart band, sort of a no frills, simple to use, simple user interface, just one single button to cater towards those customer requirements, and also bringing it to a cost point, where it makes sense, sort of having a smart band worth hundreds of dollars. That's something that wasn't sitting with the price point that our customer base was looking at. So this is a $65 smart band that we developed. It's waterproof, single button, lightweight. Okay. So here's sort of the value proposition. I know I talked about this in the previous slides, and in the interest of time, I'll skip through that. Here's sort of the financial case for the platform. So basically, there are these uh, CPT reimbursement codes that you can get through your health insurance or through Medicare, that can, for a per user per month, you can get up to $150. And sort of for our platform, we charge $35 per user per month. So the cost of the band and the monthly service can easily be taken care of as part of the CPT reimbursement codes. And this is something that is resonating really well with our customers. Okay. So these are the CPT codes. I won't get into the specifics. Okay, so now let's get to the demo part. Let me just quickly, yeah. So I'll give a couple of demos. One is around the drinking detection part, and then I'll also walk through a little bit about the capabilities of our platform. Okay, so I've worn my smart band. It has one single button here, and then I have uh, sort of three containers here: one hot coffee, one a glass of water, one a water bottle with water. And I'm gonna showcase the drinking detection part. And when I take a sip of liquid from these three containers, you'll see that this smart band will vibrate, and you'll see a red light come through that. So that's something I wanted to showcase. So I'll take a step back. Just want to make sure, since I can't see you guys, like Aishwarya, can you tell me if you can see me okay, and the smart band?
Now, yes.
Okay. So I've taken like hot coffee in my hand. I hope you heard the buzz and saw sort of a red light sort of come through here through one of the LEDs.
So yeah, we saw the red light. Yeah.
Okay. So similarly, now I'm going to take a glass of water. Yeah. So what's happening here is that there are three motions that are happening, which the sensor, the accelerometer, and the gyroscope is detecting. One is the hand gesture of taking the glass from my hand to the mouth, then the rotation of my hand to where I'm taking a sip of water, and then the third one is me taking the glass back down from my mouth, and that's what these sensors are detecting. So now let me just quickly show that with this bottle of water. Hopefully you saw the red light and heard the vibration. Okay, so let me transition and show the platform. So let me, so Aishwarya, can you see this web page that I'm sharing?
Yes, it can be seen.
Okay, great. Yeah, so I'm going to log in to our Safe Being platform. And this is the dashboard that a nurse or a caretaker uh, will see at the hospital or the nursing facility. So here's, yeah, I'm not, in the interest of time, I'm not going to go through all of these things, but I'll showcase a few things. So like a patient overview. So let's, hopefully it'll load up soon. Okay. So here so this is our celebrity clinic. This is real patient data. We have anonymized the names, but this is data from real patients. So let's take a look at George Washington. So here you can see, yeah, the intensity of green showcases the activity level of the patient in the last 1 hour or so. So they have been connected for 95%. The band battery is 81%, which is great. So let me just click on this patient. Then it shows where they are located, activity level in the last hour, the battery we just saw, the number of steps that they have taken today, the amount of sleep, how many drinks that they had, the number of cups of drinks that they had. If there's an emergency that can be triggered, if you want to talk to the patient, you can just click on this and do that. So let me get into the statistics. So this is showing the amount of sleep that this particular patient had in the last week. Let me just increase it to a few more days, so you can see sort of a pattern of that. And then, like earlier, I also talked about the quality of sleep as well, right? So this is okay. How many hours of night sleep? Are they also sleeping through the day? If so, how much? So that's something we can look at as well. And then the quality of sleep. I talked about the Pittsburgh Sleep Index. So here you can see they started off not that great, 77%. Then it ramped up to 90%, and so on. And you can also see the number of walking events. How often did they wake up at night, either to go to the bathroom or just awake for some reason? So that's something we can look at as well. Then sort of the heat map, which gives the breakdown of the day, the 24 hours in the day, the breakdown. Okay, like how often did they drink? At what hour did they drink? And so on. So you can have drink, smoke, and let's say if this patient also had some integrated device, whether the Bluetooth, Bluetooth enabled blood pressure monitor, scale, SpO2, or any of the third party devices, we can also show that as to when that reading was taken. Then this is the activity level, how active this patient was on a particular day. Low activity, medium, high, and then so this helps when we do some predictive analytics. That is, if uh, a patient's amount of low activity is increasing, that shows a sign of deterioration, and that's something that we use in our predictive analytics. Then sort of here's a timeline breakdown where one row showcases sort of one day and the breakdown of the 24 hours, and how like when did the person charge the band, sleep, whether they slept through the day. If so, then maybe potentially. So as I said, all of this data is to provide context for the nurse or the caretaker or the physician. This is not needed for them to have some sort of an intervention with the patient, but this is purely to understand the context behind the alerts and the notifications that the platform sent them. Okay, so I will, yeah, let me pause here, see if there are any questions on the couple of demos that I gave so far.
Um, yeah, I think we're good for so far.
Okay, great.
Yeah.
Okay, so let me switch back to the slides. Okay. So now let's quickly touch upon the how part. So here, like you have the elderly user on the left-hand side. We have our platform. We provide value to the family members as well as to the caretakers, either the nursing stations. Then we integrate with electronic health records so that you can give that holistic view of data to the caretaker. So here's a little bit of additional data of the capabilities of our smart band. So it has a 64 kilobyte RAM on this. So very small amount of memory that does real-time detection, classification, whether a person is drinking, whether a person is taking medication, whether a person is smoking. And then once that is done, then we send that data to the cloud for further analytics. So we use a 60 milliamp hour battery. It has a single chip that consists of accelerometer and gyroscope, simple micro USB charging, a vibration motor. I just gave a sort of a quick overview of how that works. 3 LED lights to show the whether a battery, like whether the smart band is fully charged or not. If it's less charged, then you'll just have one LED, one green LED or two green LEDs show up. So for example, here right now it's, I think, yeah, fully charged. So you'll see 3 green LEDs. It's like it's water resistant. It is certified with these classifications for US and Europe. So here's sort of what the internal of the band looks like. And here, I gave you the demo of drinking water, right? So similar medication intake. So you have the hand to mouth, taking the pill, then hand from the mouth. So this is how the data comes in through the accelerometer and gyroscope. The top chart shows the data coming from the accelerometer. The lower one is the one coming from the gyroscope. And this is what we use to do the classification of the data. So similarly, this is how the drinking pattern looks like. The hand to mouth, then the rotation to take the sip, and then hand from the mouth, like coming down. And then in this sip, we also do the conversion of sip to milliliter as well. And that's one of our biggest competitive advantages. So these are, like the security stuff we talked about like earlier. So what? Okay, you have this. Hopefully, you would agree with me. A great AI-powered technology in the remote patient monitoring space. But so what, right? So yeah, Aishwarya. So this goes back to the question that you asked me earlier. So has this been tested with in a real patient setting or not, right? And is it effective or not?
Yeah.
So this is some data that shows that. So we worked with this senior living facility, Holy Senior Living, where
Mm-hmm.
we did pre and post analysis
Okay.
about the quality metrics. And we did this for a period of 6 months. So all of these facilities gather quality metrics, and these facilities are measured on the quality metrics that they provide. So that's something we looked at. Okay, before we bring in the Somatics' Safe Being platform, what do the metrics look like? So we gathered that data, and then we placed the smart bands on the patient's wrists, and then we collected data for, or we had the patients use that smart band for 6 months, and then we collected the quality metrics again, and we saw a 49% improvement. Also, this all of this work was done in collaboration with a marketing professor called Americus Reed from the Wharton School. In fact, I'm a graduate from the Wharton School myself, and I have worked with this professor before, and he's also a strategic advisor to Somatics. So him and his team, they did the analysis of all of the data that was collected at Holy Family Senior Living, and this is something that now we are looking to get published in a peer-reviewed journal as well. But this is sort of the high-level data that shows that we see about a 49% improvement in the overall quality metrics. Then earlier I talked about that the readmission rate, the 15,000 that on an average that a hospital has to spend if a patient is readmitted within 30 days. So we are able to drop that by 17%. So you can imagine the cost savings for the hospital or the facility purely because of the reduction in the readmission rates. Then we also saw that uh, the reduction in falls were about 42%, reduction in UTIs about 52%. And one of the critical things, as I also mentioned earlier, is the engagement with the patient. That is, they truly need to be wearing the smart band 24 by 7 for this to be really valuable for the caretakers. So we saw that the adoption and adherence was about 80% and 90% respectively. So that shows that sort of the multiple iterations of the smart band that we have done that has improved the adoption and adherence of the smart band with the patients. And then we also measured the satisfaction level of the caretakers, because like bringing in a new technology, there's some sort of a learning curve, and then potentially the caretakers may always have that inhibition of, okay, is this going to truly help me, or is this going to increase the time that I have to spend with the patients in order for them to adopt this technology? And we saw that in fact this increased the empathy that the staff members had for the patients, because now they truly feel that they can take better care of the patients. So overall, this study was a great testament towards the platform that we have developed, and this is like a real data from a facility that is working with us. And yeah, finally, I would like to conclude by saying a few things that the passive remote patient monitoring is a truly powerful tool, especially in today's days where there is a big shortage of healthcare workers, and the COVID pandemic hasn't really helped the situation. Um, in fact, like this is where at times uh, the family members aren't even allowed to go and meet uh, their elderly family members at these facilities. But by having these caretaker apps, family member apps, they can gauge that, yeah, my loved one is doing really well, and I can gauge how their health and well-being is through these apps. So overall, I think the unique AI powered platform that we have that uses gesture based detection algorithms to monitor the patient's activities of daily living 24 by 7 has great potential in improving the patient lives. And We are really excited about the next generation product that we'll bring to market by December of this year, which will have additional sensors, optic sensors that can measure heart rate and SpO2, and we'll also have Wi-Fi capabilities as well. So we are super excited about this. And that's the end of my talk. So I'll pause here, see if there are any questions.
This is amazing, Amit. I think like we went through all the questions that were coming so far, but yeah, like this is amazing. So, few of the things that you pointed out with respect to like how that data can be used for like further assisting the patients, and like how that also becomes an enabler for the families who are living far away. That
Absolutely.
really makes sense. And yeah, I'm really like excited to learn more when once your next gen product comes into the market. So we
Sure.
can set up like another session where you can dig deeper into
Absolutely.
like maybe any specific use case that you've been working on. So yeah, this was great, and thank you so much for like taking out time. For all the viewers, like we will be sharing the slides that Amit had, and Amit, if you do have any other resources which you might feel that could be like useful for anybody to go through and like read and learn, do share that with me as well, so I'll just add that to the description of the video.
Sure thing. And thanks, Aishwarya. Like I really appreciated being on this forum. Thanks for your time, everyone. This
Thank you
was
so
great.
much.
I enjoyed it.
Thank you so much. Have a
Thank
good
you.
one, Amit.
Bye.
Bye.
You too. Bye.